All right, guys. So we'll roll through this. We're going to be talking about digital scanners in the pediatric dentistry realm today. As mentioned, I'm Dr. Casey Lynn. I'm from right outside of Tampa, born and raised here, spent all my time in school in the Florida area, went to Nova for pre-doc, and then did my residency at UF Naples. Opened my practice in 2018. Strictly pediatric dentistry, and I also included a tongue tie center in there around 2019, 2020. Today, main objectives, we're going to just talk about the benefits of digital scanning, like how you can bring it into your office, how you can make your workflow a little bit easier and just kind of get it going, because a lot of times taking that first step is the hardest part. So we'll talk about some of the benefits of doing so. We will jump into some of the clinical applications of a scanner. Most of what I use it for is bread and butter, pediatric dentistry, appliances, space maintainers, things that we use every day. We brought it in majorly for that. And I'll get into that a little bit more as we go into the clinical aspect. What I've learned with it is you can explore getting into new things, which is nice. You kind of open up new things for your patients, your parents to kind of come to your office for. We'll talk a little bit about scanning techniques. The cool part about the scanner is it's easy to use, easy to set up. We will run through a little demo of how quick you can set it up and kind of just depackage and get going. Learning is a little bit of practice, a lot of just playing with it and just getting used to the system. We'll talk about some workflow integration, like how to bring it into your office, how it can change some of those appointments for your impressions, your deliveries, how you can schedule a little more efficiently in your office to, focus on doing a good job, still being productive with some of those less productive visits. And then we're going to talk about financials. Like as business owners, we have to think about, is there an ROI to making an investment in new technology in the office? Is it something that I'm actually going to use, or is it something that I'm going to, put in the cabinet and let get dusty? You never want to do that as a practice owner. You want to make sure you're utilizing it, and this scanner does make it very easy to do so. So, why am I here? They approached me to talk about the scanner. I was an earlier adopter back in 2023. I took the leap and bought it at the APD. And since then, I really have not taken a physical impression in the office. I still keep the Alginet, I still keep, PBS, I'll keep some trays, but my inventory of all that has shrunken tremendously because it's not necessary. A lot of what we use it for, I can do with the scanner in a quicker, easier manner for my assistant, myself, the patient, and get a better outcome from the appliance delivered from the laboratory, which makes everything a lot more simple for you. We've integrated into the workflow of the office. We really did that by just trial and erroring, and we'll talk through little tricks you can do while you're playing with it. Getting your team integrated into it is simple. If you have a younger team, it's going to be even easier. Technology for younger generations is second nature to them, so them picking it up and using it is super simple. And then even like my older assistants who are older than I, they picked it up with just a little extra practice. We did a lot of just working on each other. Let's do it on lunch. Let's do little trial road on each other before work. And within just a couple of days, everybody was really comfortable with it. And in my office, we're just really big on want to use technology that's going to benefit us. It's going to benefit the patient. The parents are going to appreciate it. This was something that I had been researching on my own for a really long time. And when I got a chance to talk with New Smile back at the APD in 2023, kind of forced my hand. I was like, all right, this is what I've been looking for with the cordless option and the cost effectiveness of it. So we went right in. So biggest benefit for me kind of switching is I don't have to deal with horrible impression visits. Like as a pediatric dentist, we deal with a ton of tough kids. We know what tough appointments are going to be. In all honesty, like even a good kid for restorative can be a bad kid for an impression. It's a lot in the mouth on a developing kid. Getting a really good anatomical view of everything with one impression can sometimes be difficult. I used to hate those appointments. It's like I have to see the impression. I know the kid's not going to like it most of the time, and I know what anatomy I need to get, and I don't need everything that goes in that tray typically. And now when I'm doing it, my assistant's going to do almost all the work. It's majority them, very little me. I don't need to be in the room while they're scanning. I just need to check the impression afterwards, make sure it looks good. And as I mentioned, it was very simple for our team to learn to use. It was really, I opened the box. It came in kind of late in the day, and I opened things up at the end of the day. I plugged it in and started playing with it. Within 5 minutes, I was up and running. And then the next morning, introduced it to the team, let them play with it during huddle. And then we took a little, 20-minute kind of deal during lunch that day to kind of really go over what buttons to push, how to use the system. And by, 2 days later, we were using it on the daily. Like I said, the inventory is much, much less, which makes it easy. I don't have to worry about ordering that monthly, which just in the long run cuts down on costs. And then really my patients and parents have been extremely happy. Like I can get impressions on very tough patients with special needs, kids that are a little more sensory driven, that are definitely not going to tolerate a full arch impression. This is a video game to a lot of them. You introduce it, you let them play with it, let them scan and type it on. And that little bit of tell, show, do goes a long way. And those kids that are usually impossible to get impressions on, you can do it and you can deliver a lot easier given some of the band formations that they allow from the laboratory I use. And we'll go into that a little bit. Efficiency's there. So your accuracy is awesome. You're going to know whether you capture the anatomy you need or not when you're looking at your impression on the screen. It will give you a heads up if there's a little missing anatomy on a tooth, or you missed an embrasure, or you need to capture something else. As the doctor how that fabrication is going to go in the lab, whether it's hand fabricated and soldered or it's a 3D printed appliance. Where your bands are going to seat, where your bar is going to lay, so you know what you need to get. So a lot of times you don't need that full perfect impression. If you're just doing a lower lingual holding arch or a band and loop or something really simple. Now if you're doing a mouth guard or something that's a little more kind of comprehensive, you'll need to get that full anatomy, but those are usually on older kids, and it's even easier with the scanner than it is with like a alginate or VPS. Faster chair time is the biggest thing for us. I don't have to book a 30-minute appointment for a kid who needs a lot of TLC. We can get in and out of there in 15 minutes and have the impression done. The lab scripts are super simple, given it's all just electronically based, and we have templates set up for all that. We'll go through some examples of how to utilize that in your office and how to make it easy for your assistants to plug and chug. And then at the end of the day, I review any scans that need to go out, confirm the script, and get it over to the lab. The turnaround with that is a lot faster. I used to take my own impressions. I used to use my own bands. I like to seat them. I like to bend them. I wanted them to be perfect, and I'd ship them out. But obviously that's a mail to the lab, and then you have to wait for fabrication and shipment back. With this, it's off, just via the cloud. It's in their hands the next day, and they can get started on the appliance. So you will get a faster turnaround time. The biggest thing for me is I like to be able to integrate everything in my office. I use Open Dental. It's a third-party friendly platform. So if I need to do anything new or there's some new tech coming in, there's a way to kind of get a bridge for that. And this is fully compatible with all the other techs out there. And since it does have like a more open architecture system, you're going to get a typical STL file, which most laboratories use, and you're going to be able to send that to any laboratory of your choosing. I use NeoLab, which is a more pediatric ortho lab for most of my appliances, but I do work with some legit labs if I'm doing, some sort of fancy cosmetic stuff for a patient. I do some peg lateral cases a little differently and stuff, and that really has helped kind of getting the files out, getting a mock wax up for some patients, and kind of getting that going a little bit simpler. And then the biggest thing I like about it is I don't seat my own bands anymore. I do indirect banding, so I let the laboratory kind of fabricate based on the model that my impression gives them. And it makes it much simpler, and it gives you adaptability on when you can place your space maintainer specific appliances. A lot of times we'll talk about some cases where the distal aspect of those erupting sixes either have a large operculum over them, or the bone's a little high, or the kid just very sensory driven and a lot of gingivitis back there, and seating that's going to be uncomfortable. This gives us the ability to stay away from the soft tissue and make that delivery very non-stimulating, which makes it more successful and quicker in the overall. So the main reason I chose Allied Star was the fact that it kind of checked all the boxes I was looking for. I wanted cordless. I don't like a lot of cords in my office. I don't have overhead lights. I try to keep everything kind of as out of the way as possible. I'm a very family-friendly office. I let parents come back with the 2 other siblings and a stroller, and I know I have a lot of stuff in there. So for me, I wanted to make it as clean as possible and not make it laborious. Dexterity, ergonomics, we need to make sure we can use it with one hand. This kind of checked all that. I went with the cordless option. They do have have a corded option, which is a little lighter. And the only real difference is there's a cord attached, and you'll see that in the demo setup that we have. The other aspect was the laptop was all kind of fired up and ready to go. I did talk with my IT guy a lot when I was looking at different scanners out there. Which laptop do I get? How are we going to set the card up? What kind of tech do I need on the laptop so I can kind of be compatible with the scanner that we choose? This made it a very simple process. It's there for you. Everything you need from the scan software and even the NeoLab software is all on there. And it came with a great warranty. 3 years in the dental world is awesome. A lot of places will give you six to 12 months. So that was just a little peace of mind, getting some new tech in the office that you're investing in. And then the interface just being simple makes it very plug and chug easy for your assistants, which again, anytime you're integrating some new system into the office or you're changing something, your team can sometimes be a little disgruntled about that. My team knows I change things a lot because I like to keep growing, but it was very simple for them to learn, and they love playing with it. And it's pretty entertaining for the patients too. One big thing when I was looking, I didn't have anything that was specific small head for a pediatric patient at the time. That was one of my big things. We work on big kids, but we work on a lot of small kids. And we do need the ability to take impressions in smaller mouths. This tip that they have for the ped side is much smaller. You can get the same impression you do with the larger mirror tip. You just less kind of surface area per scan, but if you're working on a smaller mouth, it all equates out. The larger kids, your teens, you're doing mouth guards and stuff like that. You can just throw the adult one on there. But you can get as many of either that you want, depending on how you stock your office. One big thing for me was the recurring costs. So many companies out there will get you on the hook buying something and then charge you monthly to utilize something that you already bought. It's like property taxes. Why do we do it? But we have to in some circumstances. In this one, we didn't have to. That was one of my big things. I wanted to one and done it. Pay my money, have an awesome piece of software and tech, and then being able to use it without having to kind of chunk something out monthly. And again, we talked with open architecture. Excuse me. It does integrate with other systems. They do have a partnership with NeoLab Junior, and that's who I utilize for most of my appliances and simple ortho stuff. But you can use anything. Anybody that uses an STL, you can send to, and that's 99% of laboratories out there nowadays. So if you have a local lab that you want to use, you can still kind of benefit from it. This is just a nice little breakdown of cost comparisons. Everything that comes with it. Is there a fee? Are there different size tips? What the weight is, ergonomically for yourself and your team. You want to make sure it's not something that's going to really weigh on the wrist. You can see the difference between the AS260 and the AS200E. Price is a little different. That is your difference in corded versus non-corded. I thought this was a great snapshot. I wish I had this all kind of in one spot when I was doing my original search, when I was kind of putting my own information together. There are other scanners on the market that are not listed here. This is just some of the bigger names, but it does give you a really good kind of idea of where you're at with it and what you're getting, what you're not getting. And the Allied Star really hits on all the things that most of us are looking for. So we'll talk a little bit about your workflow. Now, traditionally, we all went through residency. We've all been practicing pediatric dentistry. We know, you got to get your impression, you're pouring your model, depending on what you're
I think Dr. Lynn froze for a second.
um,
Oh, you froze for a second there, Dr. Lynn.
Sorry. I'll backtrack to the start of this one, I guess.
Yeah, backtrack to the start of this slide and you should be good. Thanks.
All right, cool. Sorry, guys. Technical difficulties. As I was saying, this is just kind of comparison of workflow from your traditional bread and butter, taking impressions, the busy work that goes into it with your assistants. We're going to take the impression, depending on what you're using, PVS versus an alginate. You're going to have to pour model, maybe trim the model. You still have to ship it out. This is time that your team can utilize in other chairs. Being productive productive doing a recall appointment. Just something as simple as that. You're making more money per day, and you're getting people in and out a little bit quicker on these appointments. So again, you can be more efficient in your scheduling. So you can be more confident knowing like this is only going to take so much time. We can get that done, and then at the end of the day, you're just clicking through and getting your cases out. Shipping is quicker, typically because if you're doing the full digital workflow and you're not sending your own bands, you are just shipping there and you're just getting or you're not shipping there and you're just getting your delivery back. Typically it's really quick turnaround. 2 to 3 weeks is kind of what we tell patients, but a lot of times it's a lot faster, just because you don't have that shipped to your laboratory. Just looking at your traditional workflow versus your digital scanning workflow, you'll pay for this in 2 years. Like just those little nickel and dime changes, being more productive, material costs, all that kind of stuff. It will pay for itself, which is nice just from the ROI side of things. And this is strictly if you use it for just your bread and butter type stuff. So we do have a little like step-by-step walkthrough so you guys can see like how easy is it to just get the box open and go through it. This is going to be a little video. Jordan, who's not on the call with us tonight, who's another sales representative for New Smile, does this, and Aaron makes a special appearance. So I will pull this up. When you are starting to scan, make sure you're just doing simple troubleshooting with your assistants. It's very simple on the screen. There's a little box that you'll see on some of these videos that will light up green when you're on a segment. That is good to kind of be picked up. If you're on a segment that doesn't connect to that, it'll turn red. Simple enough. You just kind of drag it back to anywhere that you have scanned before and it turns green again, which makes it very simple. Like anything in dentistry, adjust your patient, adjust your position. Like, there are changes that we make when we're working on different parts of the mouth and kind of getting our ergonomics set up. So do the same with this. It's kind of common sense, but some people will just stay static with it. And then the reorientation is really smooth and simple, which is something I liked with this versus some scanners I'd use in dental school, which made it a lot easier to kind of get the gist of. And this is Jordan. So I'll play this and make sure.
Action. So today we're going to be going over how to set up your scanner and going through a full scan. So first thing you want to do is take it out of the box here and we're doing the wired scanner to this, AS260. You want to be sure to grab your power cord. We're going to get this all plugged in. So you can take a USB, plug it into your laptop here.
And the only main difference between the corded and the non-corded is the weight. And the plug into your computer is more like a little Bluetooth device. It looks like a little USB port holder. And that's really the only difference when you're unboxing.
Now you're going to want to take off your protective cap and you want to use one of your scanner tips. This one is Aaron's. So go ahead and pop this on. Take your little holder. Set it aside for right now. Now, what you want to do is you're going to want to open up your software. We're going to use AS Connect right here. So we're going to open that up. Now that we get that open, then to go into our cases in here, we're going to want to select new case. So we'll be practicing on Aaron. And as soon as you make your case name, it's going to auto-populate generate. So up here on the top right, we don't need to worry about anything else at the moment. We're going to hit scan at the top right. Once we hit that, this is going to open up what's called Scan Pro. This is our scanning software. We take our scanner off the charging base here. You can see light is always on. That does not mean it's scanning. However, when I press this button at the top, it begins to scan. Press it again to stop it. No box enters. So today we're going to be scanning Aaron. Aaron, we're going to start with the lower. So all we got to do here, click the little M button. We can see at the top of the laptop, right up there, on our lower icon. However, if you don't scan the proper upper or lower, you can always flip it in the software as well. So you don't have to worry too much about that. So we're going to go ahead and scan. So what you want to do is we want to start in the posterior on the occlusal surface. So we're going to start back here. Go back to the occlusal surface. We're going to work our way all the way around.
So the little click just telling you that it's capturing data. Something I learned after using it for a little while.
To work our way buckwheat.
You can modify this to put a little like noise or song to it. We use the Mario theme song for this. Kids love it. It just makes it way more entertaining while we're doing it. And when it stops the noise, you've kind of dropped off one of your spots. You can look at the actual laptop video screen of the scan that's being put in there and see where your little red to green box is. And we'll show you that later. But you can also go by the sound and just go back to an area that you knew.
We're going to see what information we have here. So now at this point, these specks here, these green specks, are telling me where we need to go back and hit. So we can see we have some interproximal spaces, mainly on the lingual side, and then here on the facial of the anterior of the lower incisor. So all we're going to do, we're just going to go back in, we see our spots, and we're going to touch this. Why don't you open up for me, Aaron? So again, I remembered mainly on the lingual surface of the posterior. Make sure I hit all the interproximal spaces. And then we're going to come up here to the anterior. I'm going to make sure we want to try and get about that facial side. So that should be pretty good. And what we can see here, we've filled in just about all the gaps there. We have a couple little smaller interproximal spaces, but we're perfectly good. So now we can see our 3D rendering here, really good scan. We don't need to cut anything out. Of course, if we were going to be doing sort of space maintain or anything else, we don't want to go touch up on the spaces again, just for the greens. But right now, just for records, we're good to go. So only difference would be, we're just going to do the lower today. If you wanted to, you would just click over into the upper, do the exact same thing on the upper, and then full bite, once you have the upper and the lower, just scan both sides for your full bite. However, we're just going to do the lower today. And again, the main point is you want to start in the occlusal surface in the posterior, work your way all the way around, work buccally, lingually, and then that should be your whole scan. Now we're going to click up here when we're done with our scan on the refine tab. Telling us we have not captured the upper, it's fine. So once we hit refine, what this is doing is this is turning the scan from a raw format down to an STL format. So it's really, really condensing that scan. It's kind of talking to itself. And now we can see, boom, it's refined. And now at this point, we're finished. What we can go ahead and do is we can click finish up here at the top right. And then now we have our file. We are finished. We now have Aaron's lower jaw scan in here, and we can do with it as we please. And that is your whole start to finish, setting up your scanner, getting a scan, finishing your case as quickly as that.
So it really is that fast and kind of easy to play with. One thing that a lot of docs don't think about utilizing this for is just records, like getting a record of the jaw, max and man tooth structure, and having that in the patient's chart. It's put in the cloud. It's on your system there. So you don't have to keep inventory of models. When I first started out of residency, I was doing a lot of phase 1 cases. I have tons of stone models that I had. Those were taking up room in the office. Now, even if you still have those models, if you have a slow day, put an assistant to the side, have them update patient charts, scan those models. Now you have them in the cloud and you have your records legally that you need. You don't have to hold on to those stone models anymore. And you can get rid of those, clean up some room, spring clean in a sense, and have more office space available. They're very kind of visually kind of pleasing for a lot of parents too. A lot of times, you'll talk about something, you'll show them an x-ray, but they can't see like the distal buccal of number 31. And you can, if you're doing something back there and you really want to be more comprehensive in patient-parent education, you can scan that. You're going to get a very good visual. An intraoral camera will do the trick, but this can give like the full jaw relation, how the maxilla is, occluding in that area, and then kind of what that can do in the long run. So that's really beneficial as well. Now, this is in my office. We like to do when we're training the assistants is have the laptop facing them. We just have this little cart with stuff that we'll take around the office when we're doing these things. And this is just a video. It's a little sped up, but it'll show you a full arch impression of the upper and lower, and then getting a bite registration. If you're doing something a little more comprehensive in the mouth, you will want to get upper, lower, and the proper occlusion so you can send all that information to the lab. And you'll see our patient kind of interacting with this. this. They do like kind of the computing aspect. They play a lot of video games. They're always online. They know kind of how to utilize technology. So when they're hearing the little Mario song and kind of going through the process, even if you have an anxious kid, this can get them kind of on board with the appointment and get them interacting with it a little more. This is one of my assistants who's pretty swift with it. She already got the max. We just needed that anterior palate for that aspect. And then she's going to go back after she showed the patient kind of how cool it was, and he got to play with it a little bit, rolling down to the mandible and getting all that put together. The bite registration on this is super simple. It's just a buccal corridor shot. You just have the patient occlude correctly, kind of scan the left side, right side. Computer integrates everything and puts it together for you, which makes your kind of assistant's job a lot easier. It's a lot less technical in that sense. The computer does the majority of everything. And, she's done. Now the kiddo and her can kind of look through it all. She goes through, refines it, gets it to me at the end of the day. Or if she's unsure, hey, does this look good? Do I need to capture any more anatomy before we refine things and kind of save it to the patient's chart? But that's really it. Super simple. And then you can see on the side of the computer, that little kind of black thing coming out. That is the difference between the corded versus non-corded. You plug that into your USB port, and that's what communicates Bluetooth wise with the scanner itself. And then this was a donated training video. So similar, and you'll hear the assistant getting some instructions from her doctor. And that's the green box we were talking about.
If it stops, you have to go back to an already scanned area to pick it back up.
Okay, got it.
Nice. Yeah, you're way better than me.
So that's where I like to have the assistant kind of really visualize it, especially when they're first starting, just because so they can kind of get the gist of, scanning versus dropping off unscanned area, see the red box, get back to anywhere you scanned. And even if it's like you scanned, number 19 area and you're over in 30 and you can't find your spot, just hover back over 19. The computer's going to pick it up. It's going to allow you to kind of just make your way back around the arch and capture any unfinished anatomy and put you in a good spot. Now, once you have your scan and you refined it and it's been kind of checked over by the doc, your assistant can go ahead and get this done on the side between patients. This is the NeoLab portal that's kind of integrated in with the software on the computer itself. And these are just day-to-day templates, like the things that you're going to use the most, you're going to make a template for it. So if you have new assistants in the office or, assistants who are doing the same thing in different rooms, this can all be put together for you. So the template's already kind of preset to the doctor's liking. Every case can be a little bit different, as we know, but the majority of them are pretty straightforward, especially if you're sticking with more just appliances. So you go in here, and this is just a little video of how to roll through putting a template together for your case or using a template for your case. So they're just kind of going over, they're going to choose Nance, very popular appliance in my office, and I'm sure most of yours. You just enter your patient info and things will kind of auto-populate. You go through and click what you need based on the case. Again, you're going to pick the scanner that you're using and what you use for it. You can pick your color for your acrylic button. One thing I do love about their system is sometimes I'm not even sure what I'm doing. And they have these little pictures that you can hover over to show you, like, this is what your band will look like. And it gives you much more feedback as you're going through it. And they keep updating this. Like every time I go on there and play with it, they have more of those little hover buttons. So if your assistant is not 100% sure and they want to at least get to this stage, which is like I'm about to submit to lab stage, they can, go through that, review with you as needed. And then you can have, a little training session in the office. Hey, the name of this is this. I call it this. I call everything that's not what the lab calls them. My assistants know my lingo now. But that's as simple as it goes. And then this is what I see at the end of the day. I confirm that everything on the script is correct and I hit send to lab and it's off and ready to roll. This was one thing that I really liked. It was much less, handwritten scripts. That's what I was doing for my old laboratory, a little more old school. Nothing was sent digitally on my end because I was taking my own physical impressions. This makes my life a million times easier. And then these are just, different different prescription kind of templates that are put together. If you do habit breakers, your traditional lower linguals, you pick, where you're putting it off of. Sixes is going to be the majority of what you'll be putting your bands on. The band types that they have are pretty cool. The full banded kind of subgingival is still a piece of what you can use. I do a lot of what they call SLS 3D printed bands, which just occlude on the top surface of the tooth, and they just kind of cover the buccal aspect. They don't go subgingival, so there's no tissue stimulation. And I was the most worried, and I'll kind of show you guys on a picture what the intaglio of those bands look like. But I think, no, those are all more traditionals. I have some pictures from my lab. Or some of my cases, the intaglio is like micro etched. The 3D printed appliance, it's aluminum 3D printed, and they micro etch out different surface area spots in there. So the bond strength is actually really, really good. I don't use band lock. A lot of my orthos use band lock, and that's really hard to get off sometimes. I just use the Fujisim like ortho blue. It's blue, so you can visualize it and clean it up really nice. And it is a dual cure, so you can cure and just let it set on its own. And the bond strength's awesome. That was what I was the most worried about doing some of these just occlusally retained appliances, and the retention on it is wonderful. I'm finally starting to see some of those appliances come back for debonds over the years after I started placing them a couple years ago. And the bond strength's great. It takes a little force to get off, but just like any appliance, it'll pop right off. I like this that they sent over. We kind of put this in every cabinet for assistants, especially newer assistants, kind of coming out of school. They may not be as versed in pediatric dentistry and the appliances that we use. This is just a quick and dirty. If you're making this appliance, this is what you're going to scan for. It's common sense to us, but obviously, our assistants, different learning curves for different people. And I like having this in their kind of purview. So if they do have a question, they don't have to go ask anybody. They can if they need to, but this is there to guide them along the way too. These are those different band options. So I used to do on the left Dr. Fit. That was what I was, taught to do in school. That's what I like to do. I wanted it perfectly kind of retained into the different grooves on the teeth and on the molars. I would always do Dr. Fit. I would put them in my alginate, and I would even put little staples so they didn't move around in transit, just so I knew they were sitting in the right spot when that appliance was fabricated. Now, I'd say 90% of the time, I'm using these 3D SLS bands, and they can make these extremely custom. So like, say you have a tooth that's, only 2/3 erupted, and you really need to get that space maintainer on, and you don't want to wait for that eruption to occur because you'll have even more space loss on a severely crowded patient. You can get it on there, and the lab can avoid the soft tissue for you. Just make a little note on there for it, and they can adapt and kind of 3D design this however you want. The indirect option is still there. So if you just want to scan and you want your band seated subgingivally like you've always had, nothing wrong with it. You can do that, and then you don't have to send anything shipped out to the laboratory. You don't have to ship your rings. If you want the Dr. Fit, you're still going to have that shipped to the laboratory. But the indirect's an option if you want that in between, a little quicker back and forth from the laboratory, but you want that full retention circumferentially around the tooth. So just, your comparison, traditional fix versus your SLS 3D printed. You do not need to fit any spacers because we're not going proximal between the teeth. It is going to sit above the contacts. You're going to light cure your cement just like you normally would. You're going to debond with the band remover just like you normally would. That's really the only difference. And as I mentioned, the intaglio of those is very, very nice. I do a lot of band and loops chair side now. I like the new Smile Universal kit. It's made my life a lot easier on the quick cases. This was before the chairside kit was out. I was like, hey, I'm going to make some band and loops. Obviously, we make a lot of those in pediatrics. The one thing I've noted from the scanner impressions and the 3D printed appliances, especially from NeoLab, is the fit is awesome. I don't have to bend wires and adjust things. I ended up doing that a lot with my previous laboratory, and I don't know if that was bad laboratory versus just mistakes in the pores, mistakes in the impressions, mistakes in the kind of actual fabrication of the appliance. There was always finger pointing, going on in dental school. Was this my bad? Was this the lab's bad? With this, I'd say 99% 90% of the appliances fit really good. I don't have to get my bird beaks or my pliers out anymore and kind of modify things, which has made my life a lot easier on delivery. And again, makes you more efficient on those delivery appointments. It's more predictable for seating, and you can book them accordingly and be more productive in those chairs. This is the lower lingual, and that middle view gives you a little idea. You can see it's like a little frosted on the intaglio there. That's just the appliance flipped upside down. And that gives you kind of the extra surface area. So that bond retention via your cement is much better. And it sits, just like any other appliance would. The only difference is those rings that are on the sixes back there do not go subgingival. They're sitting above the gums. So if you do have a kiddo who has poor oral hygiene and a lot of sensory aspects, you can get those cemented with minimal issues. And I've successfully cemented these on a lot of patients with special needs that I think traditionally having to force a band between the teeth, even like just getting separators in, would have been impossible, and we would have dealt with the space loss in other ways. So I'm going to go through like a few clinical cases. This is definitely, I think, my most outside the box thinking in Hail Mary that I've utilized the 3D SLS printed versions on. This was a girl, came for an emergency visit. She had discomfort, obviously, number T. We needed to get T out. And I wanted to play Space Maintainer, but 24 and 25 were barely erupted. She still had N and Q, not a good condition to place a bilateral Space Maintainer. 19 was in all the way, but I, talked to mom and I was like, hey, I just got this. I have a fancier way to make a band that won't hit that tissue on the backside of the tooth. And you can see the distal operculum on that right x-ray a little bit. I don't think it's going to last very long, but if it even lasts long enough for the lower anteriors to come in, we can transfer her to a bilateral and then we'll be set. This was right when I started using the scanner. I just saw this girl not too long ago. It's still holding up. She's not a very, very easy patient in the chair. It is fully still in retention. There's no debonds that we've had with this, knock on wood. I'm not poking the bear. I left it there. Still doing a good job. Overall, mom was super happy with it. Patient's much cooler now, but I know just putting her through anything that's not a cleaning and x-rays is a little more difficult. But very surprised with the retention there. And that's, I think, what made me a believer in it. I do it a lot on patients with special needs who do not like me in the mouth. This was another case where I knew I needed to get Jay out, but it was more of a quick turnaround sedation. So I didn't have an impression already sent out to the laboratory. A lot of times I will try to line that up. If I know I have sedation cases in 2 weeks, and I'll get a patient in a few weeks before, make sure it's fabricated, you get my impression and get it back so I can seat it while we're sedated. But this patient did extremely well for the cementation. Took a little x-ray to see what everything looked like, cleaned up a little cement, but really good to go. This was a patient who popped in my office for the first time. Never had seen him, very averse to, just nervous in the dentist. He wasn't averse. He let me do stuff with some tell show do. But we did his limited appointment, talked to mom. It was a Friday, I think. We were going for the weekend. We wanted to kind of get things taken care of. So we put the treatment plan together, had him in the chair within 10 minutes of paperwork. I used my SOAN, got him numb. This is me taking an impression post anesthesia and getting everything rolling. And then the goal is just get Jay out, take an impression, get an ANS fabricated. This showed me, because this was a little earlier on, like how efficient you can be in everything that you're doing. If you have good parent communication and the parent understands what's going on, you can go in there and kind of get the ball rolling a little quicker. You can do same day turnaround, production wise, a little bit quicker. It is beneficial for the team, beneficial for the office, super beneficial for your patient. They're not coming back, sitting, thinking about that appointment for too long. You can see the heme that's there from the injection site and stuff, and that's definitely going to show up on your screen. So you have to be cognizant of that if people are looking from a parent or other kiddo in the room. But the impression, easy to get, and this is me doing it, and I'm probably the worst in the office and still did it pretty quick and got the tooth out. Kid's super happy. Delivery appointment was 2 weeks later and it sat perfectly. So this is just more like a real world application of how you can utilize it on your day to day and just make your life a lot easier and keep people happy. Again, just more bread and butter cases in my office, utilizing the scanner to get our impressions. This was another case we were going to sedation and getting some work done. Again, kiddo did not like us being in the mouth, hence why we were going to sedation to do all this dentistry. And I utilized the same 3D SLS option for those. This is a tool that comes included with everything you purchase. If you do get the scanner and the laptop, I'm going to see if I can do this correctly. Sometimes I do, sometimes I don't. Video unavailable. What happened, Aaron? I'll try it again. We'll have to check the link. Do you know if it's active? It was active last time.
I don't know. I'll go look for it and you move on and then we'll see.
Cool. So just for what this is a tool that's AI driven that you guys can put all of your patient info in, your scans, if you have intraoral photos, and it will kind of put together a comprehensive, not only treatment plan, but like explanation for bigger cases. It's pretty cool to play with, especially if you're doing a more comprehensive case. Say you're doing some restorative dentistry with some orthodontics, and you want to kind of show some before and afters, show the watch spots, show the trouble spots, show what needs to be done. You kind of just put in your patient info and the data that you want it to spit out, and you click a button, and it puts together a whole report for you. So we kind of like to highlight that. Link's bad, so we'll kind of move forward, and if Aaron can find it, we'll show it to you. I'm sure there's just like a squiggly line in here that's wrong. So we'll get into really the nuts and bolts of like, if you're going to purchase something for your office, is it going to make you money? Are you investing to put it in the closet, or are you investing to kind of put it to work? The tangible benefits you get right off the bat are those kind of bread and butter ones. You're not going to have any more tray or material costs. Those are just little monthly things that you're purchasing, that you're keeping stocked up, that you no longer have to purchase because you're just going to keep what you had in the office as a backup plan. And you don't have to stock a ton. You don't have a whole cabinet space filled with this stuff because you need 5 different sets of trays for each set of patients and each arches and stuff. Remakes are almost non-existent. The only remakes I have are if a patient like doesn't show up for an appliance seating for 4 or 5 months, and we did have some space loss. And then if I can bend the wire, I bend it and fix it. If not, I do a remake. But if they are on the normal schedule and they come for their delivery appointment, it's going to fit 99.9% of the time. You're going to save on the lab fees because you don't have a shipping out. Now, different labs cost different money. NeoLab was different in price at a little higher level than my other laboratory that I was using, but the time advantage that I had using them versus my traditional, and then just the turnaround time in the office, being able to be in those rooms for a shorter amount of time and being more productive with other scheduled appointments, made that a non-negotiable. I was like, this is so much more worth it in our life. I'd rather work smarter and not harder. The chair time was the kind of most valuable thing. I think, you can cut down a very hard appointment to a quicker, more productive time slot, and throw a quick recall in, do some other productive procedure, minimally invasive procedure, icon, whatever you want to do in that chair in that same time. Quick appointments will fill your schedule. You'll be more productive. Parents love this. Like that's one of the bigger things. Like they don't want to be at your office longer than they have to. A lot of my parents love coming to see us, and the kids love coming to the office. But every parent is busy, especially multiple sibling kids after school. You have sports. They want to be in and out. And again, the 3D model inventory is digital. You don't need the actual space in your office for it. That is something really good, especially if you're like a peds office who does a lot of, ortho on the side, and you've been doing that for 15 years. You've got a lot of models kind of built up. I don't know what your state kind of legislature says that you have to keep it for, but it's a long time. But the biggest thing for us is just it's more efficient. And this is just what you're going to get right off the bat. Now, long-term, you will start playing with this. You're going to get more comfortable with it. You can start looking into different appliances to make, different procedures to make, in different things you can do with a scanner that would have been a little more difficult with, a traditional impression. When I first started out, I was wanting to do Invisalign. I was doing a lot of phase 1. I was trying to stay busy. I hated doing Invisalign cases because I didn't have an iTero, and I had to take a full PBS impression, and it had to be absolutely perfect. So a lot of times I would maybe not get all the anatomy somewhere. Now I'm spending more money on PBS. I'm spending more time taking the impression. And even you send it out, they're like, nope, we need this anatomy in order to kind of make this necessary. Obviously, they just want you to use the iTero. But I have done some aligner cases with this. I used to use Ortho Brain. Now we have an ortho in the office that's utilizing our scanner. And honestly, the ortho assistants, like, they're like, we like this. Like, this scanner is awesome. It's easy to use. Never had a complaint from them. And they are telling their ortho they want that on top of the iTero that they have at their main brick and mortar office. You're going to be more confident knowing that what you're sending to a laboratory, you're going to get something really good back. So you'll start becoming a little more confident in some different procedures that you do. I had mentioned I use, an adult lab for peg lateral cases. I'll scan, I'll have them do a wax up. I'll have them make like a silicone suck down, and I'll do some injection molding on those pegs, like 7 and 10 post ortho or mid ortho, depending on how I'm kind of working the case. And they come out awesome. It's way cleaner than a strip crown. Your occlusion's perfect because the laboratory can set all that up. And the aesthetics is really, really, really good. You can let your teen patient kind of pick what their teeth look like. The parent can approve it. So they kind of know what they're going to get as that bridge from a peg lateral to a likely future veneer, or full coverage crown as an adult. But we can be minimally invasive and not have to do anything on that. And if you want to do true indirect dentistry with this scanner, you can. Like, say you're like, hey, I'm going to, prep number 30 for a crown on a patient that I love, and I'm going to put a little chamfer or a shoulder margin on there. You can do that, and you can get that done in a laboratory. We do utilize this in marketing. We want our community to know that we are using newer technology, that we're making patients' lives easier, and overall just more patient satisfaction. So we highlight it on social websites. You're referring dentists, if you're doing a collaborative case on a kid, then you refer them back to them for their traditional care. They're going to see that work, and they're going to know, like, all right, this guy knows what he's doing, or this office is really up to par, and they're a little more likely to keep that referral source moving. So purchasing options. Now, this is what everybody typically wants to know. You do get unlimited training and support with Voxel, and that's the tech behind the Allied Star. You can get it with or without the laptop, and that's kind of alluded on these price differences here on the left. If you want to do your own laptop, say you're super techie, you know how to read specs and do all that, go for it. You're going to save a little bit of money. You can build your own laptop if you want, if you're really techie. I am not that kind of millennial. So for me, it was, I want it all in one spot. I want to make sure it's going to work. I didn't want to have to consult with my IT guy and have him purchase things for me. They do come with 4 large tips by default. You can order the small tips on your own. They are autoclavable. Tip for autoclaving, it's just like a intraoral camera mirror. Cover it with a little gauze before you put it in your sterilizer. It is going to keep the length of use a lot longer. We had to replace, I think, one of these. I had to order 5 more. And it was just because my assistants threw them away. They got in trouble for that. That was very recent. But other than that, no wear and tear, no, this is scratched, it's not picking up the data anymore. Everything was there. So if you want to take a little screenshot of this, just so you get kind of in your face what your pricing options are, they are there for you. And then if you're not ready to buy, they do have demo units that you can try out. I thought this was really cool that they're doing this. If you're like, hey, I want to get it in my hands, I want to touch it, and I like to do that. That's why I used it at the AAPD, got to play with it hands on. I want to get a gist in my feel what it's like. You can scan this and schedule a demo with Jordan. They will send it back, and this is just some honest feedback from a doctor. New Smile got the scanner back, and they were just super appreciative for everything. The team acclimated so quickly, they did not want to go without one. So once your team starts playing with it and they see how quick those impressions can go and how easy those appointments are versus 3 impressions because of gags and thrown up and having to clean up some puke afterwards on a gag heavy kid, your team's going to appreciate it as well. So they have to do less cleanups and clothing changes along the way. And then questions. So these are your New Smile account managers and then sales reps. They are going to be a huge resource for you guys if you do have questions. I'll stay on this slide for a few minutes just so you guys can get an idea of their info if you need it. And then the next slide will be my information. It's got my personal email on there. If you have any questions, don't hesitate to reach out. I'll get back to you. And kind of if it's clinical, if it's, technical, if you're just kind of wanting to run down how to utilize it or flow in the office, you can reach out to me and I'll help you. I'm an open book in that sense. And this is my email here. And then if you wanted to learn more about NeoLab, that's the lab that I utilize with the laptop. This is their info. They have a ton of information. They've been a really good communication lab. If there's any hiccups with, kind of me wanting something that's very weird, and I do ask for weird things sometimes, or they're not sure if this impression's good, and I'm like, nope, that impression's good. It's like a direct call. We're not waiting on hold. We're not getting put in a queue. We call and we get on the phone with either one of the representatives who can answer the question or a lab tech just directly that I can communicate with on a more doctor level. And it helps it really, really just go smoothly.
Dr. Lynn, I just emailed you the video. If you're able to play it, we found it. It's okay.
Let's see what I can do.
You're still sharing your screen, just so you know, if you want to. Just in case.
Right. Beautiful. All right. It worked. So this is that kind of AI health report that you guys can play with. It is included with the AS Connect, which is the scanning software that comes on the computer. And this is just like a little rundown of what you can do. Obviously, those are the scans that were taken. This is showing more if you're going to do some cosmetic work. You can put in what shades you're going to change things to, give a little info on kind of problem lists, what's going on. This is definitely if you're doing more comprehensive work. And I know some offices are. It's really good for patient education too, especially if you want to have your assistant put this together for a patient. If a mom's at the appointment and dad wants to know everything, you can give them this, and that can at least give them some decent feedback without them having to come back in for a follow-up consult or get on the phone with you if you're willing to do so. The AI assistant itself will just kind of put things together. And then obviously you as a doctor can read it over and figure out, is that correct or not? And it'll spit out the report. And you can just email it to them. You can print it off and give it to them. But this is definitely really good for a more in-depth kind of presentation of what's going on in a patient's mouth. It's available with it. It's cool to use. We don't use this a lot in the office. Sometimes I'll use the scanner itself, like I said, for patient education, more parent education, but sometimes for my teen patients. Like I want them to see what's going on back there. So, if I'm talking to them and I take a little peek and I'm like, hey, get a scan of that arch or get a scan of the mouth. Let's, talk to this patient after we're done with the cleaning, and we can kind of get it to them. But this really throws everything together for you. You don't have to sit there for 30 minutes and do things on your own. You can have assistant delegated to do this. And it just makes your life a little bit easier. Then you do have the ability to kind of show before and after, like if you're doing aligners, so you can kind of get the gist of like where the teeth will be, how you're prepping the case, and all that kind of stuff. And then your report's done. You can kind of demo it out and see everything there, and you can really educate along the way. So just an added bonus feature that you guys can utilize.
We do have some questions, so.
Sweet. All right. I'll stop sharing mine just so that's there. And then we can roll into questions. And if you guys do have more questions, just kind of let us know.
Exactly. Yeah, put some more questions in there. We've got 4 so far, but we're here for a while if y'all want to, so just keep them coming. Okay, first question. Is the system compatible with Invisalign?
No. And that is really the only one. It's because they have iTero specific scanners that they utilize for their Invisalign cases. That's been their stronghold on the market. That was my number one reason for not buying an iTero, because I did not want to be locked in to a monthly subscription and the ability to only use one service with that scanner. It's a big investment. Those are 40 to 60K. And for me as a pediatric dentist, not doing a ton of Invisalign, it wasn't worth it. But literally any other STL file driven aligner company out there are a ton now. Angel Aligners, ClearCorrect, like all of those are there and available. And with the technology increases and some of the patents that wore out with Invisalign, you can get just as good of cases done with some of these other aligner companies. Most of my local orthos are not utilizing Invisalign anymore because their lab fees are much better with some of the other aligner companies.
Yep. Exactly. Are there any times you have to revert back to an old school impression?
Great question, Dr. Berman. At this time, no. I have not had to pick up any alginate. I've not had to kind of go back to doing it. I still keep it stocked. I still have all the trays that I had before. I'm not going to dump the inventory just in case. Still keep, things PBS in the office just in case I need to MacGyver something and I cannot get a actual impression done with the scanner. But luckily, I haven't had to.
I will say I have 4 kids and 2 with special needs. And if I went to a dentist that was going to put alginate in their mouth, I would go somewhere else. I would not suffer through that.
Yeah,
I would not. It's not about my kids.
It's tough for the parents too. Yeah,
exactly. Yeah. Okay. Can you send the impression directly to Invisalign, or is it only with iTero? We kind of answered that already. You can't do Invisalign, but there are lots of other aligner companies coming out. I would say too that like if you explain to parents these days that like Invisalign is like the Kleenex of tissue. It's the exact same thing as, the Angel aligners or the Clear Choice or whatever. You're still getting a doctor taking the scan. The doctor is still prescribing. It's not the chintzy one that you get off Amazon and, boil the mouthpiece. So I think more parents are starting to understand that Invisalign is not the only way to go anymore.
Yeah. But if you do want to do Invisalign, yep, you either got to take your PBS or go get you an iTero and pay the monthly.
Yeah. Is this available to purchase from Canada? Yes, we do sell to Canada. So absolutely. Canadians, you're welcome here. We will also sell you a scanner. Any other questions or anything you want Dr. Lynn to elaborate on that he already touched on before we let you guys go for the evening? Oh, another question. Is there a scanner update plan or will these models be current for a while? So we do have, Allied Star has a new scanner that just came out. We don't even have it in our hands yet, but you can go to alliedstar.com and see this 3 scanner options, and it'll like give you some specs on that. However, it does, if you buy the computer with it, you will get automatic software updates and stuff. And the newer scanner that it is wireless. And the only difference really is that it has a bit greater depth of field. So you can like be a little bit farther away from the teeth. And if you're doing kind of more comprehensive cases like implants and stuff like that would be a better scanner option if you need to get some really detailed scan work. But this other option, I mean, I don't think they've come out with another scanner in years, so it'll still be really current for a long time.
Yeah, I'd say if you run an office that has a general dentistry aspect with your pediatric aspect, potentially that new one could be more beneficial for you if you're doing more crown and bridge work or implant, restorative cases. I know I'm not doing a lot of that, so I was looking for more real cost effective, but really easy to use and good tech. I think you still get that with the AS200 and the SE, the wireless version. So those guys are there. And like Erin said, she doesn't have it yet. When we get more info on that, obviously we'll keep everybody filled in.
Yeah. And it's on their website. So you can go see what the differences are. They'll give you a side-by-side comparison. They make it. So it's all out there. It's all public knowledge. So you can go see it, but maybe on the next webinar, we'll kind of touch on that one. But yeah. Again, this one is really good. This is, New Smile went out looking for the scanner with pediatric dentists in mind. We know that y'all don't need an iTero. You don't need something that's, that expensive and that heavy duty. So this was this is a great scanner for pediatric dentists.
Yeah, best of both worlds.
Yeah. Any other questions or comments or anything before we let you guys go?
All right.
I'll wrap it up then. A couple of things. Again, look for your CE in your email from either Zoe or Nicole at newsmile.com. If you do not get that, definitely check your spam folder. If you still don't get it, reach out to me or Isabella or really anyone at NewSmile. We can get you in touch with the people who can get it to you. And thank you for sharing your evening with us. And if you have plans for pediatric milled crowns.
I don't have a mill or a 3D printer, but I did build a 3D printer area in my new expansion space in the ortho room. I think that is kind of where I'll eventually go with utilizing the scanner, is being able to 3D print some stuff in the office. There are some people doing some really cool things with 3D printers and even mills and fabricating their own crowns. I believe Jared Johnson on the kind of Facebook page that a lot of us are on is playing with some of that. I'm not there yet. I'm not as kind of in the tech savvy side of things, but as we continue to kind of grow the new side of the office, that definitely is possible. Like, you could use this scanner for that. It would give you the file that you need to put to a mill with the STL, and using some of the other software components like Blue Sky or something like that. I'm sure you could do that if you want to get real fancy and start doing your own crowns. I'm just not there yet.
And the laptop actually does come preloaded with several of the 3D printing compatible softwares on it. So it's definitely compatible for some 3D printing options. And I'm sure Voxel also can get you, all set up with that too. They can kind of help you get all of your tech integrated as much as, they can.
Yeah, Voxel is really cool. I talked with them for a long time at the AAPD, and they definitely have put a lot of thought into the pediatric side of things and how doctors are going to use it in the future. So if you do have questions, they're going to be a really good resource as well.
Yeah. And on that note, if you have questions about if your programs are compatible, how it will be integrated into your office, reach out to us and we can get you in contact with Voxel. If we don't have the answer, they can definitely answer that for you guys.